Growth and development across the lifespan. Nursing questions. Question 1. A nurse assesses a 2-year-old child. Which behavior is expected? Option A. Parallel play beside another child. Option B. Formal operational thinking. Option C. Strong peer group identity. Option D. Abstract moral reasoning. The correct answer is option A. Parallel play beside another child. Toddlers often play near others rather than truly with them. Development unfolds in steps, like walking before running. Question 2. A hospitalized preschooler believes illness is punishment. What should the nurse do? Option A. Reassure the child the illness is not their fault. Option B. Ignore the belief. Option C. Use complex anatomy diagrams. Option D. Tell the child punishment is deserved. The correct answer is option A. Reassure the child the illness is not their fault. Preschool thinking can connect events magically. Reassurance cuts the false thread between illness and blame. Question 3. A school-age child is learning insulin injections. Which approach is best? Option A. Use step-by-step teaching and allow practice. Option B. Teach only the parents. Option C. Use infant language. Option D. Avoid involving the child. The correct answer is option A. Use step-by-step teaching and allow practice. School-age children gain confidence through mastery. Practice turns a frightening task into a skill they can own. Question 4. An adolescent refuses to discuss sexual health while a parent is present. What should the nurse do? Option A. Provide private time according to policy. Option B. Force discussion in front of the parent. Option C. Avoid the topic forever. Option D. Ask the parent to answer for the teen. The correct answer is option A. Provide private time according to policy. Adolescents need privacy to speak honestly. Confidential space can unlock safer choices and better teaching. Question 5. An older adult has slower reaction time. Which nursing action supports safety? Option A. Allow extra time for movement and response. Option B. Rush the client to build speed. Option C. Assume confusion is normal. Option D. Remove assistive devices. The correct answer is option A. Allow extra time for movement and response. Aging may slow processing without removing wisdom. Extra time respects ability while reducing injury risk. Question 6. A nurse teaches parents of an infant about safety. Which instruction is most important for sleep? Option A. Place the baby on the back to sleep. Option B. Use soft pillows in the crib. Option C. Place toys around the face. Option D. Let the infant sleep prone. The correct answer is option A. Place the baby on the back to sleep. Back sleeping keeps the airway safer. The crib should be a simple safe space, not a soft obstacle course. Question 7. A toddler says no to every request. How should the nurse interpret this? Option A. Normal assertion of independence. Option B. Sign of severe hostility. Option C. Proof of poor parenting. Option D. Reason to avoid choices. The correct answer is option A. Normal assertion of independence. No is a toddler's practice word for independence. Offering limited choices gives control without surrendering safety. Question 8. A nurse is planning care for a middle adult client. Which concern is common in this stage? Option A. Balancing work, family and health maintenance. Option B. Learning object permanence. Option C. Developing trust versus mistrust. Option D. Entering puberty. The correct answer is option A. Balancing work, family and health maintenance. Middle adulthood often carries many roles at once. Health teaching must fit a life already full of responsibilities. Question 9. An older adult reports loneliness after a spouse died. Which response is best? Option A. Assess support systems and grief needs. Option B. Tell the client to move on. Option C. Avoid discussing the spouse. Option D. Assume loneliness is untreatable. The correct answer is option A. Assess support systems and grief needs. Loss can echo through daily life. Assessment opens pathways to support, meaning, and connection rather than leaving grief alone in a quiet room. Question 10. A nurse teaches a 4-year-old about a procedure. Which method is best? Option A. Use simple words and play demonstration. Option B. Give a long written lecture. Option C. Explain with adult medical terms. Option D. Avoid all preparation. The correct answer is option A. Use simple words and play demonstration. Preschoolers learn through concrete images and play. A simple demonstration turns fear into something the child can see and touch. Question 11. A school-age child asks many questions about how equipment works. What does this reflect? Option A. Growing logical thinking and curiosity. Option B. Developmental regression only. Option C. Lack of intelligence. Option D, need for isolation. The correct answer is option A, growing logical thinking and curiosity. School-age thinking likes rules, tools, and reasons. Questions are the mind's way of building a sturdy bridge to understanding. Question 12. An adolescent with a chronic illness wants to make some care decisions. What should the nurse do? Option A, encourage appropriate participation in care planning. Option B, dismiss the request because the teen is not an adult. Option C, let the teen refuse all treatment secretly. Option D, avoid discussing goals. The correct answer is option A, encourage appropriate participation in care planning. Adolescents are practicing adulthood. Involving them builds responsibility and supports adherence without ignoring legal guardianship. Question 13. A nurse assesses an infant for developmental progress. Which finding is concerning if persistent beyond expected age? Option A, loss of previously gained milestones. Option B, preferring caregiver voice. Option C, startle response in newborn period. Option D, need for frequent feeding. The correct answer is option A, loss of previously gained milestones. Losing milestones is a developmental alarm. Skills should build like blocks, not disappear without investigation. Question 14. An older client has reduced thirst sensation. Which nursing teaching is useful? Option A, drink fluids regularly if not restricted. Option B, wait until very thirsty. Option C, avoid water all day. Option D, replace meals with coffee only. The correct answer is option A, drink fluids regularly if not restricted. Aging can quiet the thirst signal. Scheduled fluids prevent dehydration when the body's alarm bell rings too softly. Question 15. A young adult asks about health promotion. Which topic is appropriate? Option A, lifestyle habits that reduce long-term disease risk. Option B, only end-of-life planning. Option C, toddler discipline. Option D, retirement housing only. The correct answer is option A, lifestyle habits that reduce long-term disease risk. Young adulthood plants seeds for future health. Sleep, nutrition, exercise, and screening habits can shape decades ahead.